Alright, today we're going to be demonstrating wound care on our patient Stella Fundamentals. So here we go. Good afternoon. Can I have your name and date of birth? Alright, she said her name is Stella Fundamentals. She was born on 8/26/1942. As I'm talking to her, I would be wiping down the table, but currently, due to our situation with so many other students in the room, we have to have everything in here currently. So the table would be wiped down. We are, do you know why you're here today? Or excuse me, you know why the doctor ordered, I'm gonna edit that. So, I'm here, I gotta do a dressing change for your wound, okay? So it won't take too long. We've given the client privacy. I'm gonna go ahead and pull down the covers to reveal the wound. All right. So, first, I have verified that the doctor's orders are to put on a new wound dressing. So now I'm going to go ahead and remove the original one. And to do so, I'm going to put on a new pair of gloves. Okay. And at this point, I could use alcohol swabs and rub across the side of the tape in order to kind of loosen the adhesive. So we'll say for the sake of argument that we did that. And now we're going to remove the dressing. Okay. The dressing that we've removed is serosanguinous, so it's healthy, healing, no sign of infection, no yellow or green discharge. I would say that it's approximately 70 to 75% filled, a 5x8 bandage. So there's no odor either. So set that down. Now at this point I would be throwing that away, but we're saving that for other students to use. I would take off my gloves and put on a new pair. Now what I want to do is I want to go ahead and clean the wound. Alright, so I'm going to spray this. And I'm going to break it down into fours, okay? So I'm going to start at the closest to the wound that I can and wipe away from the wound. Okay, I'm going to fold in half, spray it again, take this quadrant and wipe away from the wound. This is stopping any bacteria from getting inside and preventing infection. Now the lower quadrant. And the last one over here. Perfect. So now that the wound is clean, we're going to, and these would be thrown away, but I'm going to keep those. Now I need to measure. This would be a new Q-tip. First, begin the width, excuse me, the length. Is approximately about 10 centimeters or 100 millimeters. The width, measuring from the widest part of the wound.
Good morning, Mr. James. How are you doing today?
This one's going to be about
problem. I'm gonna come back and check on your
24 millimeters or 2.4 centimeters. And then last, we're going to do depth. These would all be done with new Q-tips every time, but currently we only have one. You're going to go down, not using the Q-tip end, just to prevent any debris from getting into the wound.
check the order. It's the right patient.
All right.
So I'm gonna take a look at your,
And the depth is
incision,
about,
right?
let's say, 14 millimeters, or 1.4 centimeters. And then that would be thrown away as well, like the rest of them would be. Now that the measurements are taken, we've decided that the liquid that's coming out is sanguinous. It is healthy. It's clean. We're gonna put a new bandage on. So I open up a new bandage.
Take everything away and wipe the window, or else I'll wipe it with a big wipe and then so I don't have to take them away again to show you that we're doing this. Really a lot of space.
And the blue stripe is gonna go out. All right. I'm gonna go ahead and set this on the wound. And a good nurse would have already had her tape set aside, but I'm a student nurse and I'm learning, so we're gonna just do this as we go. Now all four sides are gonna want to be covered with tape to ensure that it is fastened down and is secured.
Put it on there. And I'm gonna wipe under the tape to make it a little bit easier.
I was just thinking that I did not state I would be changing my gloves
Easier so it doesn't hurt.
before putting on this dressing.
Along the whole.
But after cleaning it and throwing that all away, the next step would be to change my gloves, put on one last pair, to apply the dressing. Perfect. Now we have the dressing applied. I would go ahead and throw in my gloves now, and I would educate the patient on proper wound care and dressing change depending on when he/she are going home. Looks like they're preparing for discharge in about 3 days. So currently, we'll be doing your dressing changes until you're able to go home, but while you're here, just try to take proper care of it, proper hygiene, you know, trying not to, and eating healthy, with a high protein diet to ensure that the wound is starting to heal appropriately, and as well as like a high fluid intake to kind of keep the body system working and flushing everything else out. That's about it. So thank you, Stella, and we're done.